Health experts say COVID-19 cases are starting to trend downward in Oklahoma. Here in Tulsa County, our most recent numbers indicated 1,568 cases. That is a new low since the January area.
Yeah, Dr. Bruce Dart joins us live now to talk about some of the current trends. Thank you, Dr. Dart, as always, for being here and taking your time out to talk with us today.
Good morning, guys. Good to be here.
All right, let's start just kind of breaking down how Tulsa County and the city is doing when it comes to COVID-19.
So we're, as you mentioned earlier, we had our lowest case reports this week, our lowest since early January. We're feeling really good about what we're seeing. I mean, case counts, of course, are really going down. Hospitalizations going down. Our sewage surveillance, where we've been monitoring pathogen in sewage here in Tulsa County, has dropped as well. So all the signs are pointing towards really good information that hopefully, unless there's some kind of variant lurking around the corner, we're in really good shape here, or at least trending that direction.
I started to say, don't say that.
I know.
Right?
I know. But I agree.
But I know there are places and cases where we begin to kind of let our guard down, maybe not wear the mask. I guess what is still the best rule of thumb?
So, and I know there's lots of conversations about do we mask, do we not mask? And, you know, while numbers are looking really good, we still have to remember, if you look at our zip code map, we're still predominantly in red. We've got, I think, 10 zip codes that are orange. So we're still seeing quite a bit of circulation in the community. So while we're feeling good about where we're heading, we're still not there yet. And so I think it's still a little too early to take the mask off.
Well, and you mentioned the possibility of another variant lurking. Is there anything on your radar when it comes to that?
No, there's not. But we know that these things seem to emerge pretty much out of the blue. So we're always trying to be aware and always conducting surveillance to see what's occurring. And we know that the Omicron stealth variant has not been found here in Oklahoma yet, but it's in surrounding states. Whether that's going to impact us or not, we really don't know.
How are we doing when it comes to vaccination rates, specifically in Tulsa County, but I know across the state as well?
So we're really elevating our vaccine rates here in Tulsa County, but I really wish they were higher. We've got about over 62% of everybody in Tulsa County over 71% has at least one dose. We're closing in on 62% are fully vaccinated, and of course, it's important that people get up to date or get boosted as well. So while we're not as high as we'd like to be, we're higher than most parts of our state, but we really need to get more people to decide to be vaccinated, and more importantly, to be boosted as well.
I want to ask you a follow-up question to that, because I was thinking the other day, you know, it was a year ago that I got my vaccine, then I got the booster a few months later, and then the booster in November. Are we anticipating that this is going to be the cycle as we move forward, or do we know?
You know, I would be surprised. I mean, just like we get our annual flu vaccines, I'm pretty sure we'll have something along the lines of annual COVID vaccines, but whether that means, you know, one shot per year or two, that part we don't know yet.
Let's talk about hospitals in Tulsa. What are you hearing from our healthcare workers, how they're doing, and what the hospitals are looking like right now?
So, you know, as far as just the sheer numbers, the hospitals are doing much better. I think based on data yesterday, about 19% of the patients in hospitals are COVID patients, which is a pretty large drop from a couple of weeks ago. But, you know, they continue to be strained. Our healthcare workers are still tired because they've been dealing with this for 2 years as well. So while the numbers are going down, they're still higher than we'd like to see. I'm feeling good about the trend that we're seeing, though. But you know, we still need to help our hospitals, still need to not put ourselves in positions of exposure. And more importantly, it's still important that we not go to ERs to get COVID testing. Those ERs are for emergencies, and getting a test at this juncture is not a reason to go to any ER here in town.
I know a lot of folks may have already gotten their at-home tests from the federal government. I mean, that's going to be a good way that we can kind of monitor this. But how does that perspective, you know, weigh into what you guys do? I mean, if we're taking tests at home, you don't necessarily know our positive or negative outcomes, right?
You know, that's exactly right. And that's why things like sewage surveillance is so important, because it really tells us how much virus is circulating in the community, because we know that people have gotten their home test. More than likely, those home positive results aren't being reported. So case counts really aren't as critical a metric as they were previously. Hospitalization and that sewage data is what we're really focusing on now. And as I say, we like the way that's trending, and hopefully that trend will continue.
Is there an opportunity for people to report their at-home tests with the health department? Is that something that you all take into account if someone wants to call and give you that information?
So what the CDC is telling people is to call your primary care provider. More than likely, or hopefully, the primary care provider will follow up and confirm that test with a PCR, which we know is the gold standard, which will then be reported to us. At this juncture, we don't take reports of rapids because they really should be confirmed with PCR.
Well, Dr. Bruce Dart, we always appreciate your time. And as I mentioned, coming up on 2 years of dealing with this. And we do appreciate all that you, your department, and certainly all of our healthcare workers have done in our city for the last 2 years.
Thank you so much. And, the media has been a great partner, and we appreciate all the help that you've given us.
You bet.